What's up, guys? My name is Destiny, and I'm a licensed speech language pathologist, which is also known as an SLP. I take videos on the internet and analyze them from an SLP's perspective. So a couple of weeks ago, I posted a video about RFK's voice, and I got a lot of feedback in the comments. One of the things someone brought up is that he's actually had a few different treatments, and I wanted to kind of talk about some of those because he actually spoke publicly about one of those treatments on YouTube. So I found that YouTube video, and I figured I would talk about some of his treatments first, and then we would take a look at that video because he talks about how it has drastically improved his voice after getting that treatment. So I talked about this in a previous video, so if you didn't see that video, I'll try to link it up here, but if not, it'll be linked in the description for sure. So definitely check that video out because I already kind of talked about what his disorder is, which is spasmodic dysphonia, and I gave kind of a brief summary of the treatment options that are available both medically and clinically from an SLP. So I won't go into that again today. So I talked about the first treatment that he got, which is Botox. I didn't know it at the time, but he actually came out and said that he did in fact get some Botox treatments into, I think, one of the vocal cords, and that helps somewhat. Basically what Botox does is relax the muscles. So if you think about in the face, when someone's getting Botox treatment, they're trying to kind of relax the muscles in their face to give a more smooth appearance. So the same thing is true for the vocal cords. Typically what the doctors will do is paralyze or reduce the movement of one of the vocal cords, and that basically keeps them open. So again, go back to my other video because I kind of explained what the vocal cords look like, but briefly they kind of look like they kind of close up on each other like this, and when you're breathing they stay open. When you talk they vibrate together. With adductor spasmodic dysphonia, they're kind of slamming shut against your will, and so the Botox will basically paralyze one of the vocal cords to keep it slightly open and give the airway some space so that the speech sounds smoother when it comes out. So RFK came out and said that this definitely helped, but he was looking for something more because it wasn't consistent, and you have to consistently go and get treatments because Botox doesn't really last. It's not a permanent treatment. So he went to the Kyoto ENT Surgery Center in Japan for this treatment that is only done there. It's not approved by the FDA in the US yet, so he could only go to Japan to get this specific treatment. It's called a type 2 thyroplasty. I am not familiar with it because I'm not an ENT, but I did look it up, and basically what's going on is that they implant a titanium plate or bridge in between the vocal cords in order to keep them open. So as I talked about before, the type of dysphonia that he has causes his vocal cords to kind of slam shut. This bridge would help to keep them slightly open. It does cause a breathiness to the voice. It's kind of working against what his body is naturally trying to do, which is to close his vocal cords. And he says that it was a great success. Here is a clip of him actually promoting this thyroplasty on the ENT's YouTube. So let's take a look at what he says about it.
The surgery is really easy. A lot of people who do the surgery get an instantaneous benefit. In fact, while you're doing the surgery, you're awake, and they try the bridge out in different positions on your throat, and you can listen to your own voice. And a lot of people just get an instantaneous benefit. That did not happen to me. My benefit came over the next 6 months.
So that's interesting. I was curious to know like how they would know that it was successful as far as when they put the bridge in, because the vocal cords are an active mover. You have to kind of like listen to the voice. So that's interesting that you are awake and they kind of test it out. And I'm actually not surprised that people have some sort of instantaneous relief considering they're manipulating it in real time. If you're enjoying what you're watching right now, why haven't you subscribed yet? Subscribe. It helps the channel. Let's get back to the video.
So my voice may not sound great to you right now, but it is 100% better than it was before I went in for this surgery. My voice is very reliable now. A lot of times, particularly in the morning, I would open up my mouth and I would not know what was going to come out, if anything. And I still have, kind of a weakness in my voice that, makes it sound a little bit tremulous. but it's nothing like it was. It doesn't have the breathiness. My voice has a lot of power. I can speak in large crowds. I'm really, really happy with the fact that I went over there and did this surgery.
That's so great to hear. I mean, I am curious, so now I think we need to go back and look at what his voice, like do a comparison of what it was before he got the surgery and then now after, because I am curious. Because it still doesn't sound very natural to me, but it's great to hear that it has drastically improved since having this procedure. Just because I'm an SLP, something that I would think about is that he probably still had to do some sort of speech therapy or at least some sort of voice therapy after getting the procedure, just because, number one, when you get any sort of procedure, there's going to be some recovery time. Whatever the thing that was injured, there's going to be some sort of rehabilitation. So I'm assuming he probably still got some sort of voice therapy after this procedure. Some of the things that I think that I would do would be to kind of help him with what he talked about, like habitual things that go on, daily routine. So to just kind of make his transition after the surgery a little smoother, bring his awareness to what his voice kind of sounds like throughout the day, kind of give him some strategies to help him kind of compensate for that. So if his voice isn't so clear in the morning, to give himself a little bit of wiggle room. So if he has to have a morning engagement, that he would wake up a little earlier. Maybe do some exercises like singing, whispering, laughing, to kind of work around the speech, to work around the neurological system of speaking, because we know that that is what triggers the spasmodic dysphonia. Again, I won't talk about it too much because I already talked about it in my last video, so definitely check that one out because it's a little bit more informative. But overall, it sounds like he is doing great since having this most recent procedure. And I'm really happy for him that he found something that worked, because I know when you get this diagnosis, it kind of is like not a death wish so much, but it's always scary when you hear something is not curable. It always makes you wonder, what is the longevity of this? Am I always going to sound as terrible as I do now? And it's good to know he doesn't sound as terrible as he did before, apparently. So good for him. Thank you to the people who wrote in the comments of my last video about this treatment that he got. It was really interesting. I love that we're working together on this. If you like this video, give it a thumbs up and definitely subscribe. I'll be doing more videos like this in the future. And I love that we have this back and forth and working together about some of the things that I'm bringing up on my videos. So I'll see you guys in the next one.